My name is Agaptus Anele. I'm a research assistant at a doctoral student at Purdue University. This project, the CUAHD, Communities and Universities Addressing Healthcare Disparities, is a joint or a collaborative project that works on heart health disparities in two African American communities, Lake and Marion County. And in this project, Purdue is collaborating with Indiana Minority Health Coalition, IMHC for short, and is being funded by the Agency for Quality and Healthcare Research. In this project, in this video, you're going to see the people who made this a success, or the people who have worked on this project to make it what it is today.
So our project is titled Communities and Universities Addressing Health Disparities, and we have been working on this over the last 2 years. One of the main goals of the project has been to involve community in every step of decision making as it relates to disseminating evidence-based information into the hands of consumers. This is driven by the very simple notion that healthcare disparities exist because of lack of information infrastructures regarding treatment and effectiveness of treatment. Comparative effectiveness research offers information on treatments, their comparisons of the evidence base regarding effectiveness, side effects, so that consumers can make the best possible decision. In our project, under the framework of Communities and Universities Addressing Health Disparities, we use the culture-centered approach to put the community at the center of the decision-making. In this case, it is African American communities in Lake and Marion counties in Indiana, given the large-scale heart health disparities that are experienced by these communities. And what happens is that through advisory boards, workshops, community members come together to develop solutions to disseminate the effectiveness information among their key stakeholders.
Hi, my name is Nancy Jewell, President and CEO for the Indiana Minority Health Coalition, which is a consumer advocate group here in Indiana with the mission of eliminating health disparities in racial and ethnic minority populations. We're one of the major partners with Purdue on the Heart Healthy Project of Indiana. Two of the local communities that we provide services in are actively involved in the project, Marion and Lake County, and we were asked to participate to make sure that consumers and providers that represent the minority community, the African American community, are actively involved in providing their input on curriculum that was provided targeting African American populations. We are in the final phase of this project. It has been an interesting process. We definitely have been able through this process to educate the consumers on the importance for them to participate in research and provide input back on information that can or will be implemented at some point in their communities. In this project, it's been very clear that Purdue has no interest in just coming in to get information and then not give any benefits back to the community. And the community appreciate that. We appreciate that. We look forward to many more opportunities with Purdue. They've been a very good partner with us.
Good day, my name is Calvin Roberson, the Vice President of Planning and Program Development for the Indiana Minority Health Coalition. I also serve as the co-investigator for the Heart Health Indiana project. And we're very pleased to be part of this project because heart disease is the #1 killer of minorities here in the state of Indiana. Overall, it's the killer, but particularly minorities suffer disproportionately from this preventable disease. And this project allows us to empower our local communities to give them information about alternative treatments that they can begin to take advantage of that will help to reduce their heart health incidence and to really take ownership about what their treatments would be. And because it uses a culture-centered approach model, it is really good that we are able to get input from the community from the very beginning of the project to the very end, from designing and developing how we're going to engage the community, whether it's focus groups, key informants, interviews, whether it's workshops, whether it's the actual campaign itself, to what type of results we are having. So we're really pleased to be part of this endeavor and hope that not only would it benefit Indiana, but there's national implications that could go across other states and other parts of the country and other parts of the world potentially to really help people who are suffering from heart disease. Thank you so much.
I worked 21 years at a hospital prior to becoming the director for the coalition and served in really pretty much the same capacity doing community work, serving as the community liaison for the hospital and bringing community and business community together.
And then in addition, Dr. Janet Seabrook from our local federally qualified community health center has signed on to participate, as well as Dana Gore, who is an RN at Methodist Hospital, the community outreach nurse, has signed on to participate. And there was one other person. Dr. Artis has agreed to participate as well.
And I'm Calvin Robertson. I'm the Vice President of Planning and Program Development for the Indiana Minority Health Coalition. And I serve and tag team with Dr. Dutta here as the co-president on the project.
And I'm Mohan Dutta. I'm Professor of Communication at Purdue University and Principal Investigator on the project. I'm so glad you could all be here.
Okay, my name is Sydney Dillard. I'm a doctoral student at Purdue University. Mohan Dutta is my advisor. I study health communication and media technology and society. And I'm also a resident of Maryville, Indiana, so I'm also part of the community. Yeah.
Hi, my name is Shaunak. I'm a doctoral student at Purdue as well. I study health communication, especially HIV/AIDS in the context of marginalized populations. And I'm part of this this project with Mohan, who's my advisor.
I'm ACO Williams. I guess I'm one of the participants too, because I have had congestive heart failure. So I'm trying to get as much information as I can. I'm a realtor with Caldwell Banker. My office is out of Sherrville. I'm also a board member of Brothers Uplifting Brothers.
Sharon Liggins, you can call me Sharon, everybody else does. And I'm a retired registered nurse, and that's a fact. I've been retired, I've been a nurse for 40 years, literally. 39 years old. Sticking to that story. It's a miracle. Just so that you know my, and then I am now working with the Continuum of Care and the Drug-Free Gary Coalition. Their purposes are to work with the homeless. And so I work with 60 plus organizations who actually deal with homelessness within Northwest Indiana.
My name is Barbara Gillespie. I'm an office manager. I work for Dr. Angelique Brown here in the building. She's a general practice physician. And I'm a participant. I just want to learn as much as I can. I'm at risk.
I want to begin by giving you a little bit of an overview of what this project is in a nutshell. What we have here are 4 federal agency guides on various aspects of heart disease. This is based on the latest clinical literature. But as the guides are written in their current form, they are written in a clinical biomedical language. So this is a 3-year project, and the goal of the 3-year project is to turn the guides into the hands of the community and to let the community come up with working through the guides and making the guides culturally based within the cosmology of African American communities. Because so often when we think about the biomedical or the clinical literature, it is so out of line, out of sync with the lived experiences of African American communities. So the first year, what we are going to do is we are going to work together closely with the board in identifying ways in which the guides could be transformed into accessible formats for the community, and to develop some research questions based on which we are going to data throughout the first year. In the second year though, we are going to put the tools in the hands of the community. So we are going to make this much wider. We are going to do workshops where the community comes together and decides on strategies of putting together the information. So it could be in the form of radio, it could be in the form of television ads, in the form of audio CDs, on the form of door-to-door campaigns, whatever works based on the lived experiences of the community. And year 3 is sort of the final year where we actually turn this into the tangible product. So that's when the intervention of the campaign would be rolled out into the communities. So we would do a measurement in the beginning of the campaign. The campaign will be rolled out across Lake and Marion counties separately, and then we would evaluate it at the end of the year. As I talk about the culture-centered approach in a little bit, what you will see is that we will talk about how do we make this sustainable. Because the culture-centered approach is interested in the question of what happens when we take health information and try to make it accessible to marginalized communities. And most of the research points out that much of the interventions or campaigns are not sustainable because once the funding dries out, the attention is gone, and people move to another focal area. So the culture-centered approach really works on this idea that how do we turn this into a project of activism, in the project of advocacy. So I'm really glad to hear the experiences around this table in the context of activism and advocacy, to really make this sustainable in the context of policy and to make sure that the voices are heard in the ways that they need to be heard. So that's it in a nutshell. And so as a part of the process of the culture-centered approach, one of the things I would like to do is for us to go around the table and to hear your voices with respect to 2 questions that I will pose for you. The first question I will pose is really broad in terms of what health means to you. And what we will do is we'll go around, talk about that a little bit, and then we'll talk about what does heart health mean to you. Health in the hands of communities and really work on equipping communities to make their own decisions where the academic or university partner simply becomes an enabler. So once we identify what resources are needed by the community, we work on looking at our networks of access to figure out how to build those resources. But beyond that, it really is the community that drives the project and drives the strategies of the project. In this question, that what happens when you, for instance, turn African Americans into a number that is an epidemiological statistic. Now, if you challenge that with this idea that let's listen to some voices, what do those voices have to say? What are the stories they have to construct in the backdrop? What plays out is that over the first 2 years, we work with the advisory group and we work with the community to take these materials and find ways in which these can be turned into messages articulated through the voices and participation of local community members. You can't just come in, ask questions, and tell us what to do.
And leave.
And leave.
Hi, my name is Rati Kumar and I am a student from Purdue University in my PhD program working with Professor Mohan Datta and the Indiana Minority Health Coalition on a project for the Agency of Healthcare Research and Quality. Our project is called Communities and Universities Addressing Health Disparities, and essentially what we try to do is empower communities to talk about their health with their doctors and also to get information about the comparative effectiveness of different kinds of medications for treating heart disease related ailments.
Over the last couple of minutes, we've introduced you to this project and the people who made it possible. If you wanted to know more about the project, please visit us at our website.